So good evening everyone, thank you. My name is Dr. Sarah Cole, I'm an orthopaedic surgeon based in Cairns in far north Queensland, and tonight it's my great pleasure to welcome once again Cairns Occupational Therapy, who have been coming here for years with presentations in retrospect. But we're hearing from a new person, we're hearing from Amanda, and she's going to talk to us about this, what sounds like a wonderful way of thinking about life and occupational therapy, which of course is just as important as real life. Is that all right?
Yeah.
Are you happy to go?
Yeah, absolutely. Cool, yeah. So I am going to be talking about the Kawa Model, an approach to recovery from injury. A little bit different, I suppose, to kind of other models. And yeah, it's something I don't use all the time, but I think it's something good to kind of come back to and think about if something isn't necessarily going right, or if I feel like I've missed something in my practice. So you can probably tell by my accent, from New Zealand. I moved to Ely Beach last year, and then we've sailed up to Cairns last August in search of a woman. We've sold the boat now. It's quite a scary experience to sail here, and yeah, in search of the warmer climate, and it's really quite hot now for us, but that's all good being from New Zealand. I did my Bachelor of OT in Dunedin, and then I've done some postgrad as well in mental health and addictions and motivation and behaviour change and vocational rehab, which I think is work rehab. Yeah. Previous experience in VOC rehab, did a few years in inpatient and community mental health. And then I did some remote community work last year in Darwin, and that was some NDIS work as well. And then I came to Cairns OT last August, and currently working towards my accreditation as hand therapy. So gone through a few different roles, but yeah, I'm loving hand therapy at the moment and being able to incorporate this stuff as well. So aims of this session to hopefully get a better understanding for everyone with the Kawa Model. I don't think it's a common one that we often use. Looking at how it can be applied from a psychosocial, environmental and biomedical, so quite OT based, but I think it's good for everyone to be involved with. And then looking at it as well as being able to use it with assessment, goal setting and intervention, so more of like a long-term tool that we can use in rehab. So supporting sustainable outcomes, looking at it as a way really to develop rapport. I think it's been a really good tool to be able to understand all the factors really of the person, aside from just the diagnosis that we're working with. And probably what makes it a bit different is using mapping and storytelling as a way of communication, alongside obviously talking, but yeah, being able to draw a visual map and it kind of helps the client show their side of things as well. Why the Kawa Model? I think I've sort of touched on that. It's quite different to other models. I really love the uniqueness of being able to draw it as a picture, and I think it's actually, I don't think you can often say that a model of practice or a frame of reference is fun to do. They're often quite a boring approach, and sitting and reading through a textbook isn't for everyone. So yeah, it's something that we can take on, but I think the clients can really use it in future practice as well. It's something that they can take on board, and it's easy enough to understand. And yeah, so beneficial just from more than just a functional perspective too. So reasons for its use. I think that top diagram there is something that I come back to quite a lot, as we might see two patients with the same diagnosis but have really different outcomes. Even thinking of two people who might have the same injury, same amount of time, but yeah, even at the moment I have 6 weeks apart, but there should be no reason on paper why their recovery should be any different to the other person. And then looking into it more, we've been able to kind of understand some reasoning behind that to do with stress and pressure and lots of other reasons behind it. So yes, we're looking at the physical functional issue, but there's often a lot more that we don't necessarily get to see. So that kind of covers that top point there of being influenced by more than just what's diagnosed and what we can see on face value. There's often a lot more behind that. And it gives the client a chance to explain their injury through their own storytelling, and it might be quite different to how we have seen the injury happen. The non-medical factors, the environment, and I think this is really good as well to tap into some environmental factors that might be causing them to have difficulty, the supports that they might have around them. We might think someone's not showing up to an appointment because they've forgotten or they're lazy or it's not their priority, but it might be the fact that they're a single parent, or as a result of the injury they can't drive and they can't get to the appointment, or they might be too embarrassed to tell you the reasons behind that. So we might have already built a picture of how we view this person. So it's nice to take a step back and really sit in with them and look at the environment or what might be behind the reason for why they haven't attended those appointments. Provides a structured way to understand, and I think it's a nice, I've got a diagram here you can't see yet, but it breaks down everything really nicely in a way that you can understand, but also the client can come to the conclusion as well of what might be affecting their recovery without us having to look like we are always telling them what to do or what might be wrong. They can actually come up with the reason themselves of why something might not be working. Really good to develop rapport, and actually for us as well to learn a little bit more about the client rather than just the diagnosis side of things. It might just be about what they enjoy doing or who's in their family, or again what their supports are. So yeah, it's a nice way of developing rapport again without having to talk at them the whole time and dig into information that they might not feel like sharing or feeling is appropriate to share at the time. And visual as well, another really useful one for those who might not like communicating, or even language barrier as well. Can be really useful to draw out that picture instead of again just talking at the person. So model was developed in 1999 by a team of OTs and led by Dr. Michael Iwama. So he is a Japanese professor using a grounded theory approach of qualitative research, and it's actually the first model ever in OT practice that was developed outside of a Western English-speaking world. I think that's important because in the Eastern culture emphasises a bit more to do with, I guess, the person as a whole, rather than sometimes we might be quite focused again on that one diagnosis and the one thing that's going on. And it sounds a bit airy-fairy, but they look a little bit more about the flow and what might be interrupted in that person's life as a reason for why things might not be going the right way. And it's also a culturally responsive approach, and I don't really feel that there are lots of cultural models or ones that are supportive of that, so I think it's another good one to use of diverse client bases as well, and understanding too the cultural differences of what someone might prioritise compared to what we might not see as important. It uses the metaphor of a river flow. So that's kind of what this whole model is based on, is the life journey as a river flow, and then we're looking at the factors that might impact the flow, whether that enhances it or blocks it up and becomes quite a stagnant flow. So and it's also nice as well to be able to use it as an assessment tool, not just again that kind of textbook thing that you're reading through and picking out from to use as your reasoning. It's actually a tool that you can use with the person. So looking into the structures, You can see here around the outside. The river flow first of all is just the general life flow, progression and direction, and we've got outside is the riverbanks, so that is the environment, the context that they're in, cultural, spiritual, physical and social, so that lovely whole sense. Rocks, they are the obstacles and barriers and challenges that the person is facing. The driftwood influence and factors, and then your spaces are the opportunities that you're able to use for enhancing the flow. Yeah, so not as much on this one, but essentially looking at life as the overall flow, considering their health being the flow. The river does continue to flow, so it's not just the current function, always thinking about the fact that despite what happens, the river will continue to flow. It's just going to be at this current time. It might be a little bit slower, a little bit quicker than usual. So yeah, really kind of like seeing this as the current situation you're in, but the river will still keep flowing, being that person's life space at the moment. The riverbank, so that is the person's home environment, their social supports, culture, community, physical surroundings. And I really like this one because it's the space in which the river flows. But if you think about the environment, especially something with being at home, being unstable or hostile or negative, that's very much going to constrict the flow. Or, if it's supportive, that's great, it's going to be a big flow, but often if we're needing to use the Kawa model, something's maybe not quite right in that riverbank. Also looks at social, which is family support, work environment, relationships, friendships, and really focusing as well. I think a lot of the time people can be quite socially isolated, so considering again that flow is going to be a little bit smaller and what supports they have available to them. Looking at their physical accessibility, so their living conditions, what their cultural norms might be, their beliefs and their expectations, their religion, and yeah, the riverbank can't be changed overnight. It's not something that we can say change a hostile environment or an unstable environment, but we can at least address it and talk about what we might need to do to be able to change the structure of the riverbank. But adaptations can be made. You can put a bridge in there, or there's lots of different things that we can do, but we need to acknowledge first what might not be going right in that riverbank. Rocks, they are the life circumstances or challenges or problems that obstruct the flow, so more often than not it's probably going to be the person's current injury or the condition that they're going through. It can be caused by illness, life events or other difficulties. The bigger the rock, the greater the obstruction there is going to be to the life flow. Being the rocks, smaller rocks being minor, manageable problems, with the larger ones are going to require more intervention. And I think it's important to acknowledge as well, in terms of rocks, that there might be a pre-existing disability or illness that's always going to be there, and that's okay to acknowledge that and have that in there. That will be a rock that will stay. But we're not necessarily saying that rocks are going to be the bad thing or the end of. It's just something that we acknowledge could be another thing that will be blocking that flow and impacting what they're currently going through. The rocks interact with the riverbank and the driftwood, which we'll look at next. Can, again, not only be the physical issue, but can be the family conflicts, the work expectations, the mental health. They're all things that can start to negatively impact, as if you've got too many in there, it is going to start blocking them. And like I said before, with pre-existing illnesses or conditions, some can't be moved, but that doesn't mean we can't find compensatory strategies, and often people will come to us already with these strategies because they've had the rock for a long time. The driftwood can so personal attributes and their skills. So they can either be a supportive piece of wood or a negative or maladaptive, so they might not be as useful. They can be skills such as really good problem solving skills or coping strategies or physical capabilities. They can also be values and beliefs like your positive mindset or resilience or previous experiences that have been able to help you push along. And personality traits. They can also be quite negative and get caught between, as you can kind of see here, get caught in their own little patterns there and build up. Once you start to have one negative trait come through, we can often get caught in that complete negative mindset, and that's when they do start to pile up. So while it is good to acknowledge them, I think we want to be quite careful too in making sure that we're adding enough positive ones or enough positive attributes that they are able to kind of cancel each other out. So these are nice ones to be able to move in and out of the river. And yeah, spaces are just kind of essentially areas that you can either add to or look as a potential to be able to increase the channel or flow, and also an opportunity in there for the client or the therapist to be able to add some parts in there or suggest things that they might not have considered, and relate to what is meaningful and important. So kind of coming back to, again, I guess, talking to the client about what is motivating them to want to get through these difficult parts in the river, instead of us kind of assuming what we might think is the right thing for them to do, but it might not be a motivation, and it's probably just going to clog up their river if they're not seeing that as something really meaningful and important. Cultural considerations. So I probably used this model most when I was working in New Zealand. I was working in a Māori mental health unit, and there was a lot of focus on lots of storytelling, and I guess also a little bit off topic, but when we were working there each day, we would have to do our mihi, and that is a way of introduction by introducing yourself with where you're from, what your river is, what your mountain is, your general region of where you're from. And I just sort of thought that this relates quite a lot to that, really, and highlights the significance of the fact that people relate a lot to their land or their river or where they're from. So that really neatly quite worked in well for us, and worked really well with our clients to be able to relate to actually, I do find these concepts quite important, and instead of kind of throwing a really big medical model at them, that was something that they could relate quite well to, and most of all, I guess, develop the rapport, which is what we're trying to get initially, so that we can find out what we can do to assist them. Whenua, which is land and environment, is a concept of belonging to the land, and similarly as well, when I've looked into Indigenous culture, looking at the individual's identity is quite often as well associated with the ancestral connection to place. So I think that's really nice to be able to work with that and draw that out with people. Y, which is water, has a really significant spiritual significance to the Māori culture, as well as cosmology, so following the stars, and that represents both physical and spiritual world. And again, the same, it aligns really nicely with Indigenous culture, with similar spiritual beliefs with water, believing it to be a sacred and living entity. So I think being able to get the client's buy-in to look at this as a storytelling, and being able to tell their own story of how this is impacted is really beneficial. Flow will be disrupted if there's any imbalance from the land or cultural practices aren't aligned, and that comes back again to the riverbank, right? It's going to be a bit slimmer, or it's not going to work as well if they are noticing that there's an imbalance somewhere in what their journey is. it also allows us to get a better understanding of family roles and caregiver expectations, and I think that's an important thing to acknowledge too. Each household is going to have a different expectation of what is expected of them, and opening that up to be a non-judgmental space where they can write at home or just in general what expectations are of them, and not holding that as a judgment space. And yeah, that relates as well to the bottom there with being able to navigate the cultural assumptions. I'll read this out, but you can have a bit of a read too. So this is just a case study that I've made up, but I feel it's probably something that's quite relevant to what we would see in practice here. So Shelley is 37 years old, sustained a right distal radius fracture, and she's slipped on weak tiles at home. She's been managed with an open reduction internal fixation, works as a dental nurse. She's got 3 young children and has a husband who works as a fly-in, fly-out miner, so he's not home all the time. She's got a previous mental health history of depression and anxiety, and normally engages in yoga. She's not able to do that right now because of her injury. She's been in a cast for 6 weeks, and she's experiencing ongoing persistent aching in her right wrist and forearm, and she describes that as a burning sensation. She's got really reduced movement and complete avoidance of use of her right hand, as well as lots of swelling. So essentially pretty stuck in that position of where she's at the moment, and is starting to develop quite significant pain. She's noticed a lot of sleep issues. She doesn't have many supports at home with her husband being away. She's starting to notice that mood creep in with a bit of low mood and frustration. Her work is going to require her to be at full capacity to return to her job. Lots of fine motor skills, which is quite a concern for her given that she is not able to use her arm at all at the moment. She's also remembering that she's a mother of those 3 young children. She can't lift her youngest child at the moment, who requires constant care, and she is finding it difficult to find time to rest, and lots of pain now in her left arm as a result of compensating with her right. She's got a lot of concerns that she's not going to ever achieve the skills that she needs to return to her job, and they're starting to ruminate that, I suppose, all of the negative aspects compared to, I mean, she's got a lot on her plate, obviously, but she's finding it quite hard to look at this positively. So apologies for my handwriting here. I've looked at this before and it's quite hard to read. But if we look first, I guess, to the left edge here, I've gone in with the riverbanks. So just to separate it easier, I've put the negative aspects on the left side and the positive on the right. So experiencing social isolation, her husband is away a lot of the time, given that she's a mum of 3 young kids. She's very time poor, and she's also got really high caregiver demands. Looking on the other side of a more supportive environment, she's got a home in a nice location and she's living by the park, so she's got that nice connection to nature and be able to take her kids out there. She does have supportive family via phone call. They don't live close, but they are in regular contact and they're able to support her emotionally when she needs. She's also got a close relationship with some of her colleagues at work, and they're really supportive of her coming back. And I think it's really important to acknowledge the last one too, the access to healthcare. That's not something that everyone can have, and it's going to certainly help her along the way in terms of being a good support with her riverbank. If we now move to the rocks, so these are being the more negative or possibly the challenges and the barriers currently. She's got persistent pain with neuropathic features. She's not able to work at the moment, reduced movement and increased swelling. She's got sleep troubles, low mood and anxiety, left arm overuse, and caregiver difficulties and guilt. And now moving to the logs here. And these are quite good ones. As I said before, you can take these in and out as you can see fit, so that they don't have to stay here forever. You'll be able to see the two at the top almost kind of cancel each other out, really. So she's pushing through pain at the moment to parent. That's not necessarily going to be useful to her injury. It's probably going to increase her stress, and it's now kind of blocking in between these two rocks here. So she's already minimised her flow by those top three being quite a stressful impact on her general life flow. But looking at it from a perspective, I guess we would be working through this with her at the time. So she may have identified that she has to parent. She can't not do that or have a day off that. So maybe we look at adding in this log at the top here that childcare support is available, and it might be about working around whether she can access some of that per day so that she has time to be by herself to do some of these exercises, because it's not something, quite frankly, that she's prioritising right now given the other stresses that she's got involved. But we do know that if she's able to do some of that rehab and do some of her pain education, she's going to be able to see some benefit in that recovery. What she was able to identify herself, and the logs below there, is that she's resourceful. She's got a husband that's away often. She's learned some things that she's able to do to become resourceful and do things for herself, and also got a lot of resiliency, and she's identified those things as logs that are going to be able to push her through that and assist with her recovery. And then we've got the one down to the side here, fear of permanent loss. And I mean that's valid if she's hasn't had the education or awareness of how this injury might impact her. It's a very fair reality to believe that she might have permanent loss and she's really seeing the recovery as a time frame based thing where if she hasn't achieved it by this certain date, then something's terribly wrong and she might lose the ability of using her arm. She has then identified another useful one here is mindfulness from yoga, which is going to be really important for her system at the moment, considering how roofed up it is with all of the significant stresses that she's got going on. Another one I think that we see quite commonly too is the fear of failure at work. I think there's a real drive from a lot of people to get back to work as soon as possible. Because they have a fear of believing or thinking that people are thinking that they're just trying to slow it up or want more time off work, which often could not be further from the case. So they're trying to push back. But the worst thing that we can do really is, especially in a pain or a setting where someone is already really stressed or worried, then putting them back into that environment when they're not ready is going to be quite detrimental to their outcomes in terms of return to work. And we've also got in here that she is most certainly motivated, so that's going to be another one that pushes through here. I don't know if anyone else has noted anything. This is just sort of what I made from my own case study that I made up here, but I don't know if anyone else has any rocks or logs or environmental factors that they would find beneficial.
I mean, I think that high caregiver demands, sometimes that's a grandparent or a disabled child, things like that.
Yeah.
High needs.
Yeah.
And the phone call, family supported by phone call, is just not quite the same sometimes.
Yeah, absolutely, yeah. Yeah, and I think that was a really good one to highlight in here, because I think we do see that often as well with like the FIFO mining community. It can be a pretty big burden sometimes for these caregivers, especially when you introduce an injury. It might have just been functioning right and they might have been able to manage the mental health, but as soon as something quite significant happens, it can be a huge impact for that person.
Yeah, I like your emphasis on the access to healthcare, because as you say, we're very blessed what we've got here.
Yeah, for sure. Yeah, and I think that's been a really good one for me to sit back on, as I said before too, with if someone's not coming to their appointment, we're quite quick to be like, wonder what they were doing. They'd forgotten that appointment or hadn't been bothered to come in. But when you call, there's often a lot more going on, or they might have just needed that support or known what's available to them to be able to get to those appointments too. So, yeah. Cool. Anyone else?
I like that the childcare support for doing their exercises. I think you're probably the same in that it's not just the exercises, that whole self-care that they are going to need to actually recover.
Yeah.
Not going to recover if they're just constantly pushing.
And I feel like mums can be really guilty of that. Like they'll do every single thing the kids need, and then you've run out of time. It's like, okay, well, I won't do that. So, like,
I feel guilty for that too.
Exactly.
Yes.
And then it's a shame spiral. And so it's like,
yeah, and I think that's what I can't remember if I mentioned this later on too, but kind of identifying that it's not about sending this person home and saying, yep, you need to do this many times a day, this many repetitions. We need to make it relevant to their home environment. So it might be about what they can do with what they enjoy doing at home as well. But yeah, using that as a way of rehab too, with kind of doing a secret plan of rehab, I suppose, by incorporating that. Yeah. So I guess this would be the initial stage of doing the Kawa model, but then after this stage I would probably be sitting down once we've done this together and kind of getting them to identify the rocks here, and then coming up with suggestions themselves on how to be able to manage those. I mean, the rocks can't always be moved, as we said, but being able to use some more of that driftwood of things that are useful to push stuff through. They're going to be a lot more likely to know themselves what helps, as opposed to me kind of chucking through a few ideas of what I might like doing that might not be relevant or important to them. So really kind of putting them in the driving seat of their rehab as well can be really important.
I can see real similarities with the DIMS and SIMS that we often refer to when we're doing pain education as well, that we want people to have a sense of being aware of what the danger signals are going to be and what the safety signals are. So we might deliberately be wanting to break up a log jam into smaller bits and almost deliberately add in some things so that it pushes things on. So the safety and the good things, and sometimes it's permission to do things differently and just to take a break so that you're not constantly doing the thing.
Validating the process over
and that this is going to take time, this is not going to be fast.
Being kind of realistic with the person too. That's a really good point. And always kind of, for every negative one on here, it's nice to be able to put a positive to suggest how that could be cancelled out, and certainly acknowledging that these negative aspects are here, but not seeing them necessarily as negative, acknowledging them, but seeing what else you can do to move forward with that. So that's, as I said, I'd carry on kind of working on them with this, and it's a nice one to be able to do initially at the start, for them to be able to take this home and pop it up somewhere where they can look at that regularly and kind of ponder each day how they might be able to change a little bit of that to make a more positive impact, and then doing it at the end again, and hopefully seeing a few more positive pieces of driftwood or removing some of those rocks as well, but also really helps to keep someone quite accountable to be able to review that on a weekly basis and see what they might have done to be able to address one of those aspects on there.
It gives them an opportunity to report back in a certain way. It's like, so I've worked on those rocks, or I realised another big rock is the, and I often hear that I realise work cover is a big rock, or my insurer is a big rock, and I can't move that at the moment, but I might be able to work on just pushing it to one side so it isn't as looming and as, and I often encourage people to deal with work cover once a week, but not every day. Sort of say to them, you can ring me if you must ring me, only on a Friday morning between 9 and 10. And so then, I'm expecting this, I'm braced for this, I have my notebook ready, I have my questions ready, I've done my whatever you wanted me to follow up. But then it takes away I don't know if you've ever been waiting on a call back from someone, and just the stress that goes with this. Any minute now they're going to call, but I can't sit and watch my television show, I can't do my exercises, I can't
it's everything on hold.
And I think too, with anyone going, there's the immediate looming thing of like almost worrying about justifying what they're in the middle of, but then I think there's also a future component as well, like what's my income going to look like? Like I've had clients say, like, I'm not there yet, I have house payments, like this is a very real thing, and we can't just magically make that go away. And particularly for a lot of my male clients that might be like the sole income, like that very much impacts on them. And they're almost always in really physical jobs. So
mining, money in her and having to go back to that.
Mining, fitting, mechanics, like just you really, and it's a really big thing, and also linked into the identity, because if they're the dad, they're the provider, like, it's, even if there's different gender roles now, it's still very much, it's visceral, they feel it.
And that's a good point as well, like with if one of these rocks might be to do with work and just feeling the immense pressure of work, kind of talking through whether that might just be us becoming involved to have a chat to the employer and working out what might be available, or they might have actually had quite a significant fear of what work would think, and really they haven't talked to them about what is available, and it might just be about us being the mediator there and going, oh well, what have you tried thinking about how you might be able to do it this way, and gradually getting them back in, because it's going to be a lot easier doing a gradual return, especially for Shelley, than going straight back into it and expected to use all of her fine motor skills just straight back into a dentistry role, which is going to be a lot of sustained work for her hand. And looking, I guess, at how she might be able to do some of those fine motor skills at home with some of her kids, or just looking at alternative ways to develop that strength for her. Cool. Anything else on that one? Right, so how can we look at this as a way of changing intervention? I've said it a few times, so we focus a lot on what is wrong and how we can fix it, more of a singular mindset on what the issue is. And there are other components that we miss, which broadly affect the outcome. And as I said before, like having two people at the moment with the same injury, just a broadly different outcome of how long things are taking for them. We've been able to identify that there's just one huge stressor, a big stress for this person that has absolutely changed the outcome for them. Self-expectations of work as well. This is going back to Shelley needing to address her parenting demands, her significant self-expectations of work, whether she can be relying on some of those close relationships with her colleagues to ease her way back into work, whether that might just be about going for a visit one day to pop in and make it less overwhelming for her full return. And then working with her low mood and anxiety as well in order to address that outcome. I have talked about that, so instead of focusing on a particular angle of where her rest needs to be or her grip strength measurement, we need to reframe it in tasks that she actually wants to achieve at home. So feeling confident using her hand in it is something that is genuinely enjoyable to her, and that doesn't necessarily mean being able to pick up her child, like obviously she wants to pick up her child, but it might be about getting back into some really slow stretching yoga movements, and she knows that is something that has been really good for her mental health. So you're kind of getting two things out of that one, as well as that she can gradually get back into normal life and her own enjoyment. instead of expecting her to complete the daily exercises, explore what the rocks might be in the driftwood that are impacting that. But overall, yeah, treating the pain and the injury as the whole picture, and they all kind of flow on, which is nicely. So the pain being the rock, now it's interacting with with the riverbank, so the stress, the poor sleep, the lack of support already caving in the support of that the river, and then adding in the driftwood. So again, it can be positive and negative, but each one is going to be impacting the overall picture of how this person is recovering. And yeah, the intervention can provide education and brings up points that you just wouldn't really think about a lot of the time, to be explaining and providing education on other aspects. And I guess the most important thing, putting that person in control of their own river, holding them accountable, and they're knowing what's going on in there and what they need to change. Because we see them sometimes once a week, they're in control a lot of the other time of how their river flows, so we can make that impact for maybe an hour a day, but really the rest of the week is up to them and how they're able to manage their own river flow. As any model, it has some constraints. Time is probably one of them. I would spend a fair amount of time, in fact, I wouldn't be doing this on a first appointment with a client, because it does go quite deep into some personal things, so it does take a bit of time to develop that and go through that. It's not necessarily going to work for every program. If you're seeing someone for a short amount of time, it's not going to be relevant or probably that useful. Better suited clients where the rapport has already been established, because it can become quite personal, and they have to become quite honest about the vulnerabilities, otherwise it's not really a useful tool. And I think that's probably an important aspect too. I've used this before where it has drawn out suicidal ideation from someone, which hadn't been at all expected. The injury, they had no pre-existing mental health in it, and it had come to a huge surprise, but they had a plan, and it was pretty serious. So I then spent the rest of the day just making sure they were supported, and obviously calling all the right people. So I guess that's just something to be aware of. It can become quite personal, and when you're dealing with the vulnerabilities and honesty, you need to be prepared to be able to manage that as well. But yeah, whilst that was quite an intense experience, I think it showed that it was quite a good one to kind of draw out what we needed to be focusing on. I was focusing on the injury, and that wasn't what needed to be focused on at the time. Won't work with someone who wants an immediate fix. So we can't draw the river and the person be automatically fixed. And the same as that probably as well, reading your person. I was saying to these guys before, I did it on my partner last night, and he's not injured, so it wasn't relevant to him, and he's quite a manly man, a carpenter, and he didn't see the relevance of it to himself. So I think picking your person, he's not experiencing any stress, and he's going quite happy as he is, so it's not going to be relevant to everyone in the right space. So yeah, I think just picking someone who is going to kind of buy into this model and understand what they might need to do, and be willing to participate.
It'd be really interesting if one day he says, now I understand there's that bloody great rock. Yeah. No, he's not against it, but I think at the time he felt that he didn't see it as a relevant thing. But yeah, for him, he didn't see it.
Maybe also that's a cultural thing. I just wonder if
Maybe life's too
in
good.
Japan,
Yeah, life is. I mean, I like it. So yeah,
but
but
in Japan, that metaphor would just be around them all the time. They would just be seeing the river and
Yeah.
the structure. They would look at the river and see that rather than just see moss on the bank or whatever.
yeah.
They see that flow.
Yeah. And yeah, sometimes people aren't in this space. I think of a few clients who this might be useful for, but they are not in a space to acknowledge or talk about mental health as well. So they're going to see it again probably as a bit of a picture rather than something that can be useful for them. Needs to be client-led, and I've absolutely been guilty before of trying to throw in some positive aspects that I'm seeing in a person that I think that's great driftwood to be using, that's just not a priority for them, or that's not something they see as a positive thing. It's just what I've seen in the person. So I need to keep my hands off that person's river. It's your own river, and we guide them and explain the model, but it really is for them to be writing in. I'm more than able to kind of gently suggest some barriers at times that someone might not have thought of, but generally try to keep it led by themselves. And the last one I explained before as well, so can reveal some traumatic information, and you've got to be able to know where to place that and how to respond to that, and if that needs to be immediate or whether other referrals need to be sent on. It's not always going to be like that, obviously, but just knowing what you need to do or what information you might need to act on, and that comes to as well. For example, riverbank, maybe delving a bit more into the person's environment or home environment and understanding that it could be quite hostile. The priority at that time doesn't become obviously continuing with the river. It becomes about talking about how you can manage that, and that's going to obviously too impact long term on that person's injury. That's it. Cool. Does anyone have any questions?
Well, my question was I wanted to hear about how scary the sailing was, but we can wait. I want to know lots of details on that one. The things I was reflecting on was what might the patient be prioritising that we wouldn't, and a classic example is the patient that prioritises smoking, and I struggle to understand why they're prioritising that, but obviously there's lots of really good reasons for why they are smoking, because otherwise they wouldn't be doing it, right? Yeah. So, and good being maybe not the right word, but just maybe trying to see that from their perspective.
And it's so frustrating for us, right, as well, seeing that, why can't you just stop, but there's so much more behind it.
Well, there must be more, so it's there.
So even just naming it is useful. I'm
maybe
very
that's what this is.
Careful how I bring it up, and I just want them to know, I really need you to know, I'm not saying you've got to stop, but I need you to know that oxygen is really important. All the way down here particularly, all the way down here, oxygen is important, and the smoking takes the oxygen out of your blood, and that's a whole bunch of crap that is very unhelpful to you, and therefore, you're not going to heal the same. So this, would it be a rock or a driftwood or what?
I guess it depends on that person's priority, right? If they're not willing to move that, then, and if they're also not seeing it as a rock, who'll be to put that in there.
Oh, wow. No, but often they do. They don't really want to be smart. Sometimes they just can't stop at that limit, or that they've just done it for so long. And I think the trouble is when they not able to do the usual everyday activities, they're more likely to smoke.
Of course.
Just coming to work, just even saying that. So a lot of people find that when they're off work, they're more likely to smoke more rather than less. What do you think you could do?
And that's such a tricky one, because someone might put that as a positive driftwood because it's generally assisting their stress management really well.
Yeah,
so
true. They do.
It's an actual stress management strategy for some people. It's tricky.
I underestimated the social side of smoking, because I had a situation where a chappie was in a post-op recovery, still in hospital, but very bored in hospital, so out with the smokers. Because I'm man, if there was a group doing cards or something instead of smoking.
Have you seen a meme where people say, I'm having my break and I don't smoke, and so they're blowing bubbles?
Oh, I love that. I love that. Yeah, can they do a laugh circle and blow bubbles instead?
But even accessibility wise with vaping and stuff like that, a lot of people or younger generations are constantly inside, and like it's
Yes.
it's not even
True.
a conscious thought. It's in my hand. It's like a fidget
Yeah.
or something. So it's not just you have to go outside and have a cigarette or you have to roll it. It's easy to access.
I talk about rolling it though. Some people see that I can roll my smoke now as I have succeeded in that therapy. And I have to laugh at that because it's like, okay. Now I have a new hobby, one of my patients says. I'm into hydroponics. He's growing interesting substances that he later rolls.
Good on you.
Yeah, just need to do one-handed now.
So the river will flow regardless of the outside influences. Is that also part of the metaphor? Like you just keep moving. And
Yeah, it
there's
keeps going.
Yeah, it's not a stagnant sort of image. It's actually
Yeah.
still moving. And can you just run me again what is a riverbank? A riverbank is something that is unchangeable circumstance, I feel like.
More the environment, so I think about it quite a lot really with like supports. So something
Yeah.
a support is something that holds up the structure, right? So
Okay.
I guess social supports, but then also I don't know if I mentioned there or not, like the physical environment too, like it actually might be someone who's injured and they can't now get up the stairs, right? So that's
Yes,
a huge
okay.
environmental factor.
They can't go home to their house because
Yeah.
they can't access the bath or whatever.
Yeah.
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 Yeah. Okay. Yeah. I think I get that. And I was going to say that if you find people talking about rocks, you'll know that the talk's worked. If the patients start telling you that rock won't go down my way, then you know that we've been listening to your talk.
Hopefully that becomes our work chat at lunch.
Yeah, true. I just wanted to reflect again on your husband, and I do see that patient obviously because I see a lot of work cover patients who really just. Well, I don't know if they don't. It's not so much that they don't get. It's just not on their radar, if that makes sense. Like they look sort of almost confused when I try and talk to them about that kind of thing. But I think they do get it though. Like I think they understand what I'm talking about. When I'm talking about the environment around them and the things that might be slowing them down.
Yeah.
Do you feel like it was just a resistance to the concept, or do you feel like it's a resistance to the whole, to even thinking about it? Is that what I'm
Maybe,
doing?
yeah, I don't know. I actually had a client today who I'm gently introducing some aspects, and I'm never really sure whether it goes in or not. But when they come back and have said, I've actually thought about that thing that you've talked about.
Right,
And just quietly going,
yeah, okay.
yeah, that's good.
Don't have to say anything, just...
Yeah. Or and not like if they're not responding well the first time, it might be about continuing to use that language to kind of throw around in the ongoing sessions, but not forcing it on them, you know, just using that as a general concept, like, oh, that's an annoying rock to be considering one day how we might be able to move that, and then carrying on with your normal conversation, right? But just kind of throwing those keywords around so it's lingering for them. They can go and think about it, but not have to, if they don't feel comfortable talking with me about it yet, then that's fine, as long as the concepts are kind of there to be able to come back to it.
And I also feel like in work cover claims, you're not really supposed to pretend. You're supposed to pretend like they don't have a home life. You know, like that is completely irrelevant. And I find that very challenging because, you know, obviously it concerns me greatly what supports they're going home to.
Yeah.
You know, day surgery, you know, things like that. What's actually going on? And I guess, like you say, we're hyper focused on isolated injuries and isolated circumstances, and it's not really a good way to look after a patient.
Or I've had someone a few months ago where it got to surgery day and had no way of getting home, lived 2 flights of stairs with no lift, and just expected to carry on with life, and just do all of that themselves where no one had kind of considered any other factors of how they might get home.
How that might be a problem. Yeah.
And the day surgery won't release you.
They lie. They really won't release you. That's great.
It was just as well that they must see the person decide. I had a family member that attempted to do that. It's like, I'll be fine. I'll just, I've been seen before, I'm going to be fine. And I just need to get home, and I don't want to tell my family to come and help me because I'm strong and independent.
Well, yeah, but I mean, it's lovely to be strong and independent, but I do sort of sometimes really drive it home a bit to sort of say, who is your support person? You know, this is just a day surgery. What happens when something? Yeah, what happens when you're really, something really important happens to you, and who is out there, and they'll often say, there's no one, and then they cave, and then they do actually have people that they could ask, and just trying to sort of show them that they can ask. This is a big deal.
And
you're having an operation. Let's.
If there is no one, then they need to work out how to get someone. Not a partner, but as in a mutual helper that they can help as well, because everyone needs people. So
I do drop them in it a bit.
Yeah.
Long pause.
I
Stay in
think
your home.
I think we have this really individualistic concept, and I get that even there's a lot of earlier occupational therapy models that, okay, this is your motivation, this is your this, and it's all like this individual capacity stuff, but it ignores the fact that for most of human history we've lived in communities or multi-generational homes. So, like, weirdly enough, this whole living at home by yourself with no one is kind of weird in terms of human history.
And other cultures as well.
And other cultures who would still be living multi-generation. Yeah.
Yes.
Yeah, acknowledging the norms of what someone else's life is compared to yours, I think. What we might expect.
So the space concept, is that kind of a way of feeding in information that might be more positive and might be more helpful? How have you used the space?
Kind of leaving that, I guess, as opportunity. To add bits along the way or take bits along the way. But the spaces one is kind of the hardest one to place, really. But I guess it's kind of to do with your flow, your general life flow.
And stopping the jams.
Seeing that as your opportunity to kind of move forward with. There's nothing in that space, positive or negative. That's just kind of again part of your flow and what you can add to that, maybe.
Yeah, that's not. I mean, that's obviously in Japanese culture, but it's not so much in our culture, is it? So I think that's probably an important thing for us to embrace. I mean, even yoga flow. Do you know what I mean? Like that whole concept of flow is not sort of recognised as much.
No, not at all.
We just kind of next barrier, next next problem, next clinic, next next run, next rather than seeing it as a like more continuity and
it keeps on flowing.
Because people ask me about career options. People want to hear that their career can be linear. Just this model sort of makes me think about how people see where they want to be, but they don't see any of the rocks on the way. And all I can see is all the rocks. When people ask me about career pathways, and that's just as a parallel to like an injury pathway. A patient comes to me with an injury. On the first consult, I'm trying to show them where they're going to be in 12 months, which is challenging. But trying to show them that there might be a rock in the way it blows their mind, because it's just taken all their momentum and all their sort of resilience to kind of present to the appointment, and then trying to show them.
And that's kind of like
circuitous,
a nice way to be able to not be the bad man sometimes in situations and get them to front up of, I actually hadn't considered too, like, those rocks, instead of you being the person who's saying, it might not work because of this, like get them to really go, what might you anticipate a challenge being along the way, and they're writing it in as opposed to you being the one writing it in.
I could do that.
I think this could work really 3D too. I think you could have things rather than you write onto some of Dr. Bowles' pens over there and thinking they'd be great driftwood.
You have some more. Have as many as you want. Okay, well so like I said before, that's time, which is great, because that means we'll be able to. And one of the things that I've been thinking a lot about is how many good people we have in Cairns doing really good work. And so I really appreciate the transition that you've made to take on hand therapy. I can see that that is a long journey as well with a few rocks because it really looks like quite hard work, but incredibly rewarding. And so I congratulate you on that decision. But then also just the people we've got in the room is just spectacular. So thank you all for coming.
Thank you.